Hello everyone, hope you all are doing well. Today I am going to discuss about micturition, and I have divided the whole topic in 3 parts. Today in first part you will learn about the physiological anatomy of urinary bladder and its nerve supply. What is micturition? It is a process by which urinary bladder empties when it becomes filled. Let's discuss about the physiological anatomy of urinary bladder. Now, urinary bladder is a sac-like structure and composed of smooth muscle fiber cells, and it has mainly 2 parts. Number 1, body, and this portion is the body, and number 2 is the neck region, and this is the neck region. Let's find out the muscles of urinary bladder. Bladder wall smooth muscle is called detrusor muscle, and the type of the muscle, that is smooth muscle, that are 3 types: longitudinal, transverse and spiral. So we have got smooth muscle, that is called detrusor muscles, and it has 3 types of smooth muscles, that is longitudinal, transverse and spiral smooth muscles. Now the smooth muscle fibers are extended in all directions, it is longitudinal, transversely and spiral, and the fibers fuse with one another, and low resistance electric pathway is present among the fibers, so the action potential can spread along the entire detrusor muscle at a time, so a whole bladder contraction is possible at a time. Now, bladder neck is 2 to 3 cm long wall composed of the same detrusor muscle, and it is interwoven with elastic tissue and forms a muscle bundle called internal sphincter. Now this is the bladder, this region is the bladder neck region, and here the detrusor muscle is interwoven with some elastic tissue, and it forms this green portion. It is called internal sphincter. So this is the internal sphincter, that is smooth muscle bundle in the neck region, and it is tonically contracted all the time and prevents the passage of urine. Only at the time of micturition or when the pressure rises above the critical level, it opens. So all the time it is closed, tonically closed, and at the time of urination it only opens. Now beyond that internal sphincter there is a voluntary skeletal muscle which encircles the urethra. This is a voluntary skeletal muscle. This is the prostate, this blue portion is the prostate, and below that is a voluntary skeletal muscle, and it is called the external sphincter. Now it is under voluntary control of the nervous system. The 2 ureters coming from the kidney passes behind the bladder. Let's zoom it. It is these dotted lines. These are the dotted lines. These dotted lines are that it passes behind the bladder, and it opens about 1 to 2 cm above the orifice of the urethra, that is 1 to 2 cm above the orifice of the urethra. This is the orifice of the urethra, and the opening of the ureter is 1 to 2 centimeter above the orifice of the urethra, and this ureter actually enters the bladder obliquely through the detrusor muscle. That is, it enters obliquely through the detrusor muscle. Then it passes 1 to 2 centimeter beneath the bladder mucosa before emptying into the bladder. This oblique course of the ureter through the bladder wall inhibits the urine backflow as the pressure inside the bladder increases, and it will close the orifice of the ureter. So the backflow of urine from the bladder to ureter is closed. When the pressure is increased inside the bladder, it will close the orifice of the ureters. And there is a ridge of tissue on that area. This is the ridge of tissue that forms a triangular area. This is a triangular area. It is called Trigon of Bladder. Two angles of the trigon are formed by the two opening. These are the two angles of the trigon. These are formed by two opening of the ureters. Let's discuss about the nerve supply of bladder, which is very important one. The main nerve supply of the bladder is by pelvic nerve that enters the spinal cord through the sacral plexus and sacral segment 2, 3 and 4. That is, the main nerve supply is pelvic nerve through the sacral plexus segment 2, 3 and 4, and it has both sensory and motor nerve. This green one is the sensory nerve, and it detects the degree of stress of the bladder wall. So the sensory nerve, this green one, detects the degree of stress of bladder wall. And motor nerve, these are the parasympathetic fibers. These nerves ends in the ganglion cell in the bladder wall. Then short postganglionic nerve supply the detrusor muscle. Now these are called the nerve of voiding because they causes contraction of the detrusor muscle and relaxation of internal sphincter. Now this contraction of the detrusor muscle and relaxation of internal sphincter facilitates the voiding or the micturition process, and it causes emptying of the bladder. So it is called the nerve of voiding. Among the other two types of nerve supply of bladder, the most important one is the skeletal motor nerve or the somatic nerve fiber that originates from the same S2, S3, S4 segment and transmitted through pudendal nerve and supplies the external urethral sphincter. That is the same segment S2, S3, S4, and this portion is the skeletal motor nerve. It supplies via the pudendal nerve and it supplies the external urethral sphincter. This orange color is the external urethral sphincter. You already know that. And this is under voluntary control. It has also got the sensory nerve supply. This green one is the sensory nerve supply. The third type of nerve supply of bladder is sympathetic nerve supply from the sympathetic chain through the hypogastric nerve from the spinal segment lumbar 1, 2 and 3 spinal segment. Now these fibers mainly stimulates the blood vessels, and to some extent it supplies the bladder, and it prevents the reflux of semen into the bladder during ejaculation. And the sensory fibers, that is the green colored one, in the sensory fibers, it carries sensation of the bladder fullness and pain sensation of the bladder. And these are called nerve of feeling because it causes relaxation of the detrusor muscle and simultaneously the contraction of the internal sphincter. So relaxation of the detrusor muscle and contraction of the internal sphincter, so urine cannot pass through the internal sphincter. So these nerves are called nerve of feeling. Let's see the overview of the nerve supply of bladder. The main nerve supply is the pelvic nerve via the sacral segment S2, S3, S4, and the number 2 nerve supply is somatic supply by pudendal nerve via same S2, S3, S4 segment, and the third type of nerve supply is sympathetic supply via the hypogastric nerve and via the spinal segment, that is lumbar segment L1, L2 and L3. If you have any question, ask me in the comment section below.